Hi there, everybody. This is Lee Thurburn, and today I am visiting with a good long-term friend of mine, Brenda Briscoe. And I have known Brenda, Brenda, do you think it's been 20 years? It's been a long time.
At least 15. I'm not sure. Probably
Yes.
probably 15.
Okay, 50, a long time. And I will tell you this about Brenda. There is not anybody I have ever met that is more committed to the health and wellness of her clients. And that's the business that she's in. But, she is just such a caring person that really loves making sure that people are feeling the best that they can feel. And so I am excited to be visiting with Brenda today. Brenda, thank you for making time to visit.
Well, thank you for saying those things. I appreciate it, Lee.
So, Brenda, you are generally speaking, I would say, in the health and wellness industry, but of course, that covers a pretty broad spectrum. Why don't you just take a minute and introduce everybody and to introduce yourself and tell everybody what exactly you do.
Okay, thank you. So I'm Brenda Briscoe. I work with a functional medicine clinic called Living Well Dallas, and we're located on Preston at Campbell. And we are all about finding the source or root cause of your health condition and treating that root cause. So I do Bowen Therapy, which is a hands-on, very gentle but effective pain relief technique. And that's the hat that I wear. We all here are a team at this functional medicine clinic. And I love what gets me up in the morning is knowing I get to help people with their pain.
So you, in specific, do a couple of different things that I know of, and maybe more that I don't. But you're a practitioner and even a teacher, I believe, a trainer in a technique called Bowen Therapy. And then you also do work with lights, LED lights. So would you talk a little bit about both of those, what they are and what kind of problems they can help people with?
Yeah, sure. Thanks for asking about that. So Bowen Therapy has been around for about 25 years or more. It is named after Tom Bowen of Australia, who is deceased. He did not name it after himself. In fact, he hardly, taught it to people. He had some interns, and those interns, after his death, went out and started teaching it, and they named it Bowen Therapy after him. So I have been doing Bowen Therapy for 22 years, and it's known to be it's known for being gentle and effective, and for its quick, profound, and long-lasting resolution to deep core problems. And so this is not only, it doesn't only address pain, but it also addresses things like respiratory problems, like asthma and allergies. It addresses digestive and elimination problems. So really every system of the body can be affected in a positive way with Bowen Therapy. And then the LED light therapy I added to my repertoire about 6 or 7 years ago. And I did this because there is one condition that I was treating people for that I wasn't getting the really quick results that I was used to getting with Bowen Therapy, and that is I'm going blank. That is neuropathy, peripheral neuropathy. So that has a lot to do with circulation problems. So LED lights are great at improving circulation. And as a matter of fact, they help to create new blood vessels where the little capillaries where maybe they're clogged up. it can create new ones, and that's called angiogenesis. It also can help restore nerves that have been damaged, not deadened nerves, but damaged nerves, and that's called neurogenesis. So both of those together can really improve the condition of peripheral neuropathy. And that, so I added that. Now the LED lights that I have are approved by the FDA for increasing blood and lymphatic supply and circulation, and decreasing pain, swelling, and inflammation. And neuropathy is all about that. But what I found was it not only helped my clients who had neuropathy, but I tried it on all kinds of things. And guess what? It is great for helping digestive problems. It's great for helping any kind of pain, actually, because it stimulates the release of a couple of very important molecules in the blood. And one is nitric oxide, and that enlarges the blood vessels so that you get more blood flowing through the area where you place these lights. And they're in pads, embedded into pads. So by increasing the blood supply there, you're bringing more oxygen, you're bringing more healing nutrients and enzymes for quicker healing. And then the other molecule is that it stimulates the release of is ATP, adenosine triphosphate. So that simply helps with, I'm going to call it cellular house cleaning. In other words, moving toxins and debris out of the cells to make room for the new blood supply coming in, the healing nutrients and oxygen.
So with the lights that basically they increase blood flow, you mentioned they sort of do what nitrates will do in your blood. How long lasting is the impact of the light therapy?
Oh, great question. So in the beginning, you get a few hours of increase of that blood supply. And then as you add time and more sessions, then you get a cumulative effect. So it does last longer and longer and longer, days instead of hours.
The reason I asked that question is, like many people, I take nitrate tablets, not the quick release, but slow release ones, because I have issues that need to be addressed with nitrates, and I'm just wondering. So, how deep inside the body can the lights have that impact? So, if somebody has blood flow issues, say, for example, with their heart, which is, like it's in the middle of your body, right? That's a long ways for the light waves to go. Does it have an impact just like superficially or near the surface, or does it have a deep penetrating capability?
Another great question. So I use polychromatic lights, and that means there are different colors. And so the different colors travel or penetrate the different distances in the body. So the blue lights that I have are more for surface issues, skin rashes, eczema, psoriasis, and wounds that won't heal, diabetic wounds that won't heal. The red goes a little farther, about like that, just maybe an inch. And so that will affect nerves and muscles and fascia. Now the near infrared lights that I have will penetrate all the way through glands and organs and all the soft tissue, all the way to bone. So I've even used those near infrared lights, which are invisible to the naked eye, but they are the most penetrable ones. And I've even used them for bone fractures, to help heal bone fractures. And my clients who have done that go back to their doctor, and the doctors are very, very pleased at their quick healing.
Interesting. Now let's focus. I have one more question on Bowen therapy, and like a lot of people, have had massages of some sort, right? And I think Bowen therapy is different in many respects to the kind of massages that people might be relaxative or rolfing or whatever. There's a lot of different massage techniques out there. What are people going to notice when they have the Bowen therapy massage from you? What are the differences they're going to notice?
Well, they'll notice one thing, they don't have to take their clothes off. So some people appreciate that. It's done through lightweight, loose-fitting clothing. It's very gentle compared to many techniques. And I say gentle, yet very effective. You're going to, some people that have never been exposed to it and it's their first time, they think, well, when is she going to do something? Because it is just that light and gentle. Yet throughout the session, they notice themselves being extremely relaxed, and it's an enjoyable experience. And often they will have a quick relief of pain within the session. And sometimes, however, their best response is going to be maybe 5 days later, because I say that Bowen therapy is progressive in nature, meaning the body takes the information, the nervous system incorporates that information and takes some time to process all that, and where each day may be a little better up until the full response to a session, which could be 5 to 10 days later.
So you've mentioned, and kind of in closing here, I want to kind of run through a quick list of the kinds of ailments that basically you would be have a very effective treatment for with either the Bowen therapy or the light therapy or a combination of the two. I know fibromyalgia is one that I know you've had great success with, and you've mentioned neuropathy. I'm sure there's a lot of different types of neuropathy, but what other kinds of ailments, if somebody has one or knows somebody that has one, what are give me a list of a few of the things that you are very effective at treating so that people can, hear it and then respond.
Yeah, well, there's two categories, acute or chronic. So when I say acute, I mean, you've just sprained an ankle or you just pulled a hamstring, something like that, where it's an injury that you've sustained and it needs quick attention. So Bowen therapy is beautiful at addressing those issues and getting a very, very quick response. I remember, for example, when I sprained my own ankle and I couldn't put any pressure on it. It was extremely painful. I did the Bowen therapy that night, again in the morning on just the ankle. I was surprised myself that I was able to get up, put full weight on it with no pain and no limping. That doesn't mean that it was healed that quickly. That means that it just tells your body, hey, you don't have to hurt while you heal. So I was able to go through my healing stage a little quicker by doing Bowen therapy on it every now and then, and not having to limp and cause other compensations. Now, the other kind of pain would be more like pain syndromes. You've had something for a while, is chronic. Things like carpal tunnel syndrome or TMJ syndrome. I work every day with people with neck and back pain, so that's the most common ones that I'm very successful at healing. But my very favorite, because it is so debilitating and it's rewarding to be able to get people back to life, back to their normal lives, is migraine headaches. And I would say that I'm 95% effective, or the therapy is 95% effective with treating migraine headaches. And that is a major thing for people. It doesn't matter how long they've had the migraine headaches. It could have been decades, or it could be brand new. So oftentimes it'll just take one, maybe 2 or 3 sessions to be permanently, or at least long, to have permanent or long time resolution.
That's one of the things I've always liked about what you describe your services and therapies do, is you don't necessarily have to go for months and months and months. Very often you'll be able to get an immediate, powerful, and significant impact within just a few sessions. And that's always nice for people to hear, that they can get immediate and significant and lasting relief. Brenda, thank you very much for your time today. Folks, if you want to learn more, Brenda, of course, will be glad to visit with you. Go to bowentherapyindallas.com or wherever you see this video, there'll be links. Just follow one of those links and get in touch with Brenda. She'll be glad to answer your questions. Brenda, thank you for your time today. I'll
Very
see you
much,
soon.
Lee.
Okay, bye-bye.
Bye.